So in this video, I'm joined by Dr. Timothy McCall, who's a qualified medical doctor and also the longtime medical editor for Yoga Journal. You may also recognize his probably his most famous book, Yoga as Medicine, from a lot of yogi bookshelves, especially yoga therapists. And in this video, he's teaching me an advanced version of alternate nostril breathing, which you're probably familiar with if you've done a bit of yoga. But he's teaching me how to do it with a kind of addition, not just of closing one nostril, but of valving the other nostril with your free finger to create greater resistance and control. So yeah, I recommend that you do it along with me and let me know what you think in the comments below. So Timothy, I guess 3 questions. Is there anyone who shouldn't do this? Is there anyone who will really benefit from this, and what are the benefits?
Okay. With any breathing technique, you want to be sure that you're comfortable throughout the practice. So if you find yourself feeling like you're suffocating or feeling like you can't really bring air in, or you're getting anxious, or you're noticing that you're having to take a catch-up breath, kind of gasp and breathe in, those are all signs that you're pushing yourself too far. Some people who have a severely deviated septum or have polyps in the nose may not be able to do alternate nostril breathing. Some people, and now I'm going to teach it using the fingers. Some people with bad arthritis, some people with a shoulder tendonitis, other things could affect your ability to have your hand up there, keep it up there. So again, I think if you're careful, it's something that people can tolerate. Now, the other thing that you can do as an alternative that I have found is kind of safe for everyone is what I call mental Nadi Sodhana, mental alternate nostril breathing, where you imagine the air coming in the left nostril, then exiting the right. Then you imagine it coming in the right and exiting the left, continuing that pattern back and forth. And the amazing thing is, when you imagine it, your body almost always carries out your wishes. And so that I found even beginners can quite comfortably manage, generally. And you know what? Sometimes someone who you totally think should be able to do this, it just doesn't work. They don't like it. It agitates them, whatever. So, in yoga therapy, the reality always trumps the theory. And if someone doesn't like something or is not feeling right, or you don't like what you see when the person does it when you're teaching it, doesn't matter if it's supposed to be good for that condition. It's probably not going to be something that's going to be helpful. Okay, so then the idea of alternate nostril breathing, as I suggested, is to move the air in and out one nostril at a time. Now, the way it's typically taught is to just use the thumb to block one nostril and the fourth finger to block the other nostril and kind of do this. And I don't know if you can hear my breathing there, but it was a little rough and a little erratic when I did that. So one of the things we talked about in that dysfunctional breathing course was how we want to make the breath be smooth and subtle and even. And so just as we use Ujjayi breath to close the vocal cords, which acts as kind of a valve to allow us to finally adjust how much air comes in and out, we can do the same thing by using the other finger in alternate nostril breathing. So in other words, I would put the thumb down on the kind of soft part of the right nostril, and then take the tip of the fourth finger. And if you go to the nasal bone, and I can just kind of slide down from the nasal bone until you just get to the place where the cartilage starts, where it gets soft. Very light pressure then can partially block that nostril. So I'll do this now. I'll inhale to this left nostril. And then I'll block the left nostril with the pad of the fourth finger, switch the thumb to the tip, and then exhale and keep it position. Inhale. So it's a back and forth. And it may feel quite awkward if you haven't done this before at first, because you haven't gotten used to how to do it. But once you've been doing this for a while, you can very subtly lift that valving finger or turn it a little bit to one side or the other to allow you to get, so, normally when people breathe, they kind of go, it's kind of like a bell-shaped curve. And what I'm looking for is more like this, where you're bringing about the same amount of air. Say it's a 4-second breath. Same amount of air is coming in the first second as the third second. It's smooth and regular, even transition to the other. So that's the theory. And so what I'm going to ask you to do then is just close your eyes and then bring your hand up. And generally what we do is we take the first two fingers and kind of bend them into the palm if that's comfortable. And then have the thumb and the fourth finger. Some people use the fourth and fifth together. I don't personally do that. So then I'm going to, first of all, just inhale and exhale. And then the next time you inhale, block the right nostril, valve the left, and inhale. Then block the left, valve the right, exhale. Inhale. Exhale. Just keep up the inhalation and exhalation. You're always exhaling, then inhaling from one nostril, then exhaling and inhaling from the second. Some people have a tendency to kind of turn their head in the direction of the hand, so just try to keep your head looking forward. You're doing fine, but just maybe other people out there trying this who do that. Just notice that. Try to keep your shoulder relaxed. Try not to hike that shoulder up. So let's just do 2 more breaths. And the next time you exhale through the left nostril, you can keep your eyes closed, lower your hand, and then just keep your eyes closed and just keep your focus on the breath in the nostrils. Notice whether one seems to be more dominant or whether they seem somewhat even. Just notice. And then notice how perhaps even after just a couple minutes of alternate nostril breathing, how your mind feels a little more receptive to going into a meditative state.
I can really feel a lot more information in my body as well. There's a lot more sensory flow from the body to the mind after doing that.
Nice, yeah. So I feel that many of us make a huge mistake in our yoga practice. We spend 99% of our time on asana. And I say to people, you know, you've done all this preparatory work that's the setup to have a deep pranayama and meditation with all this asana to get the body ready for it, to calm the rajas, bring you more sattvic state. Don't skip the best part of the meal. Do 2 minutes of Nadi Sodhana, alternate nostril breathing, and maybe sit for 3 minutes in meditation, or just starting to move in that direction. That's a 5-minute thing that can make a huge difference to your health and well-being. And so I generally, when I teach, even when I'm teaching something that's primarily asana based, I'm always going to put a little breathing and meditation at the end of the practice, because it just seems like just a shame to not take advantage of that opportunity.
Awesome. Thank you, Timothy. That was really good. Thank you.
Glad you liked it.
So I hope you enjoyed that. Let me know what you thought in the comments below. I've done 2 other videos with Timothy, which I'll leave links for around here. And I've also done other interactive videos with breathing experts like Patrick McEwen, Patricia Gerbog and Richard Brown that you can do along with me. I'll leave links for those as well. If you enjoyed this video, let me know what you thought in the comments below. And if you want to see more videos like this, then hit the subscribe button and I'll see you soon.